Hello everybody and welcome to another video. I'm amazingly anatomical and I'm so excited to make videos on the human body and science in general. Today we're going to talk about gases. Yay! In a more scientific sense, we're going to explore the anatomy of the respiratory system and diseases and disorders that can result from problems in the respiratory system. As usual, all from the high school perspective. Let's dive in. Hang on a second. Before we start, what is the purpose of the respiratory system? Well, the respiratory system is the organ system responsible for our breathing. Pretty important, right? Some vital functions of this system are providing oxygen to our cells, allowing us to talk and smell, removing carbon dioxide when we exhale, protecting our airways from pollutants, and keeping the air at the right temperature in our bodies to function. Since that's settled, let's move on to the anatomy of the respiratory system. Our respiratory system includes the mouth and nose, pharynx, lungs, trachea, sinuses, bronchial tubes, ribs, diaphragm, lung lobes, bronchioles, pleura, alveoli, capillaries, larynx, epiglottis, and cilia. Wow, that was a handful. Anyway, to start off with the mouth and nose, they are openings in our body that allow us to breathe outside air and get it into our respiratory system. The pharynx, or simply known as the throat, is a tube that delivers air from our mouth and nose to the trachea. Our lungs are two organs that take out the oxygen from the air we breathe and transfer it to our blood. The trachea, or windpipe, connects our lungs and throats. Sinuses are little openings between the bones in our head, and they allow the temperature and humidity of the air we breathe to be regulated. Bronchial tubes are below our trachea and connect to both of the lungs. Our ribs protect the heart and lungs, and our diaphragm helps our lungs pull in and push out air. Lung lobes are sections of the lungs, and to be more precise, there are 3 for the right lung and 2 for the left lung. Bronchioles are the small branches of the bronchial tubes that connect to our alveoli. The pleura is the thin layer that covers our lung lobes and separates the lungs from our chest wall. The alveoli are tiny sacs in our lungs where oxygen and carbon dioxide are exchanged. Capillaries are the blood vessels in our alveoli that are responsible for physically moving the oxygen and carbon dioxide. The larynx, or voice box, is hollow and allows us to, talk when our air moves in and out of the body. The epiglottis is a tissue flap at the beginning of our trachea that closes to keep food and drinks out of the airway. It only closes when we swallow. And lastly, the cilia are the little hairs that filter nuisances like dust out of the airways by moving similarly to waves. The respiratory system has diseases, just like any other organ system. With this system, however, diseases are scarier since a lot of them affect the way we intake oxygen and regulate other gases in our body. I'm going to start us off with the upper and lower respiratory infections. This is caused by viruses and sometimes bacteria. Upper respiratory tract infections affect the nose, sinuses, and throat, while lower respiratory tract infections affect the airway and lungs. Next up is asthma. Asthma occurs when the lining of the bronchial tubes swell, and this causes the airways to narrow and reduce the flow of air into and out of the lungs. Pneumonia. Pneumonia is when the alveoli are filled with pus and fluid, which makes breathing painful and limits oxygen intake. Chronic obstructive pulmonary disease, or known as COPD, is a lung ailment that is characterized by a persistent blockage of airflow from the lungs. COPD is primarily caused by tobacco smoking and includes emphysema and chronic bronchitis. Newborn respiratory distress syndrome, aka ARDS, is a problem often seen in premature babies. This is mainly caused by a lack of a slippery substance in the lungs called surfactant. This substance helps the lungs fill with air and keeps the air sacs from deflating. Surfactant is present when the lungs are fully developed. Moving on, let's talk about tuberculosis. Tuberculosis is caused by Mycobacterium tuberculosis, and it was a huge public health issue in the late 19th century and resurged in the 1980s due to the AIDS pandemic. The symptoms of tuberculosis are cough, fever, blood, phlegm, and fatigue. Next up is lung cancer. Lung cancer is the most common cancer in the world and the leading cause of cancer death in men and women in the United States. The leading cause of lung cancer is cigarette smoking, and high levels of pollution, radiation, and asbestos exposure may also increase the risk for lung cancer. Next up is pneumothorax. A pneumothorax is an abnormal collection of air or gas in the pleural space that causes an uncoupling of the lung from the chest wall, making the pressure from 756 to 760 millimeters of mercury deflates the tissue in the lungs and moves everything out of place. Pneumothorax is most often caused by chest injury, any blunt or penetrating injury to the chest wall, and this can cause lung collapse. Pneumothorax can be caused by underlying disease or ruptured air blisters as well. And lastly, pneumothorax can occur spontaneously for no obvious reason. Next up is pleural effusion. Pleural effusion is excess fluid that accumulates in the pleural cavity, and this cavity is the fluid-filled space that surrounds the lungs. This excess can impair breathing by limiting the expansion of the lungs. Some causes of pleural effusion are tuberculosis, parapneumonic, which is pneumonia, lung abscess, and bronchiectasis, malignancy and pulmonary embolism, congestive heart failure, nephrotic syndrome, and liver cirrhosis. Lastly, I'm going to be talking about hemothorax. Hemothorax is an abnormal collection of blood in the pleural space that causes an uncoupling of the lung from the chest wall. And that's the end of the video. I know that was a lot of information, but if you're interested in learning about anything else, please let me know in the comments below. Also, if you can, please leave a like and subscribe, and check out my previous videos. Thanks for watching, and I'll see you guys in the next one. Bye!